All right, welcome to episode 8 of The Dreamers. We bring on individuals whose stories not only empower the future generation, are also inspiring them. We took a bit of a break. I feel like we took a break kind of just to regather ourselves, but in the future months, we're having a lot more content for you guys. And I guess for introductions, I'm Munir Rahman.
And I'm Aswan Musa, and we're back in Houston with Dr. Tuan Truong. Let me go ahead and introduce him. He is a double board certified plastic surgeon, Mayo Clinic trained with advanced fellowship expertise in reconstructive and aesthetic surgery. His career has taken him from training at world-class institutions to teaching the next generation of surgeons, and now to building a thriving practice. Dr. Truong's story is one of resilience, risk-taking, and purpose, and we're honored to have you on the Dreamers podcast.
And welcome to the Dreamers podcast, Dr. Truong.
Oh, I appreciate it, guys. Asman and Manib, I think what you're doing here is a fantastic way to get your names out there. Just getting this information out for people who are just interested in getting into medicine. I know you've already talked with much more esteemed colleagues than myself, including, I think, the head of medicine over at UH. I mean, that's fantastic.
Thank you. I appreciate it.
With today, the way that media works, this is definitely a great way for people to get out there, get their message across, and then for the next generation of people who are interested in going into medicine, into doing this kind of thing. So,
thank you so much.
That means a lot.
Yeah. Thank you. Also, let's go ahead and get started with the first question. We'll go right into it. I want to talk about your journey, especially in undergrad. What made you want to kind of choose medicine over other fields?
Sure. So actually, I thought about being a lawyer going into college, which is a whole different field. Yeah, exactly. But like you guys, I always had a little bit of an interest. I had my grandfather was a family physician for a long time, and like many aspiring people, the next generation of immigrants as well, I shadowed him for summer and decided that just wasn't for me. Not to say that family medicine and taking care of patients long term isn't a bad thing, but I just didn't feel like that was for me. But my true inspiration probably was getting to do an internship at the end of my sophomore year of college. So that's when people are starting to figure out, when everyone's asking your family, the advisors, they're all asking, what do you want to do? It's about 20 years old, 21 years old. And I lucked upon, this internship over at the county hospital up in Dallas, where I grew up. So Department Hospital, it's where JFK was shot. Fantastic teaching institution, world-class facilities, great medical school. And my preceptor, which is someone who you kind of shadow and learn from. She was a nurse case manager who helped take care and manage patients in the hospital where we're trying to get them discharged. And she was the case manager for general and plastic surgery. So that was my first introduction into the hospital, and B, getting to see patients in an acute setting and seeing what all the stuff that they needed and required. And from there, it was just a very full speed ahead. At that point, I was getting into work, and the requirements of the job was getting there, I think at 7 or 8, and then you'd leave by 30. But for me, I was getting there even earlier than that. I was talking to the medical students, talking with the surgical residents. I got to shadow them, follow them in surgery, which is a very unique opportunity. And then by evening time, 4 days a week, I was actually studying for the MCAT. So I was taking one of those prep courses. And just that kind of hard work really is what spurred me on, did well. And then by that time, by the end of that summer, really, I figured out that I wanted to go into medicine, because the summer before, I was actually a bellman. I didn't know what to do with my career path at that point. And for me, that was just a unique summer opportunity, and did the same thing the following year. I really enjoyed it. And I was blessed to be able to do that again. And the opportunity that afforded. So I use that as my primary example for students who are interested in getting into medicine, that whatever opportunity can arise, go ahead and take it. It can be a small window. It may not be a door that opens up for you.
Never hurts.
Yeah. It never hurts. You get to learn to interact with people, and even the experiences of being a bellman, allowed me to interact with people from all walks of life. And you think, oh, well, how does that help you today? I think it helps me in general.
Social skills.
Social skills. I think the social interaction we have, being able to talk, being able to communicate, it's so vital, so important.
It's very important.
Especially in medicine, because you're learning a whole new language. If you can't translate that, if you can't reinterpret that, the most complex things into a much more basic verbiage for people to understand, you're never going to get your point across. I mean, there are fantastic doctors out there who still don't understand that, and honestly, I'd probably choose them to be my physician as well. But there's that human element of it.
Yeah.
And I think that's what a lot of medical schools are looking for too. And you've seen that a lot of transition wise with how they're viewing your applications. So, when I was in medical school, scores, grades, those are very important. But now you're seeing a whole lot more for extracurricular activities, personality, especially passion. That's something that really will enrich your life and help you lead a very sustained and prolonged career in medicine.
Yeah. And also, I kind of what you said about you doing like what was the course that you did or the program that you did that kind of made you want to go to?
Oh, well, it was a collegiate internship up the hospital. There's a couple programs like that still available out there. I'm not sure how many are still out there, but look hard enough and
you'll find something.
I
mean, for us, we joined AMSA. You spoke at their senior former officers. That kind of what made me want to go into medicine specifically, because just overall, just like the social aspect of, I always thought medicine was too impossible to achieve, especially for someone, I'm not very book smart, but I realized that it's really not. As long as you put the hard work in, that's all that matters. And so I feel like that's one of the main things I've learned as well.
And I want to ask you, if you did go to the JD route, what type of lawyer would you have become?
I don't know. When I thought about it, my aunt had told me to become patent law, with everything out there. I don't even know anything about that. He certainly sounds interesting enough. Yeah. We've probably all seen Suits, We get flips for a couple of years. I don't think good for law.
Yeah.
We're faking it was really my kind of thing, but something a little bit more low key, but also just helping people, find their path and helping them understand what's possible, and again, helping them to achieve their dreams.
Oh, great. So another question I had was, during your residency, you went from general surgery to plastic surgery, and then you did your fellowship in craniofacial surgery, and then pediatric plastic surgery. How would you describe your journey during these years?
It's a long journey. I'll be honest with you. So that includes 4 years of medical school. You're looking at, with general surgery, it's 5 years of training. Some programs are upwards of 6 or 7. Plastic surgery then becomes another 3 years of training. And then if you want to do some sort of subspecialty to specialize in, that's an extra year, sometimes 2 as well. So all in all, I spent 9 years out of medical school, in training. And I think it's helped prepare me for a whole host of different scenarios, a whole variety of different disease states that I can help take care of. And and really when we talk about passion, I do find my career path very much a calling. I try to not waste the skills and abilities that I've attained over that time. It has discouraged a lot of, family members, other students from doing the same thing. And you hear, 9 years, that's a decade of your life. After medical school. Luckily, I've had a great amount of support, and I think that's important too. Family, your friends, the close-knit group of people that you have around you, because it's a very trying experience. Of the people that you train with become lifelong friends and colleagues, and I still keep in touch with quite a few of them. But it's become your inner circle becomes just very small. And even though we talked about communication being a very huge part of medicine these days, it's that ability to switch on and off between professional and personal that helps, I think, for me, stay a little bit grounded. Because if you don't want to be taking your work home with you, the stresses of long hours of patient care, and then trying to take it out family to dog, and so these are things that I found over those 9 years to be prioritized. And that's just my journey. That's not everyone else's. Everyone will prioritize what they want to prioritize. Career is very important, obviously. Longevity, personal satisfaction, what are you doing too? But again, everyone's path just beats a little bit different.
For it's like everyone's path's gonna be different. It's not the same formula for everybody.
Yeah.
And also kind of following up on that question is looking back, what was the hardest lesson that you had during those years and how did it help you kind of shape into the surgeon you are today?
Gosh, the hardest lesson to learn of all probably is just accepting mistakes. The people that train with you, who are mentoring you along the way, they're always going to be hard on you because medicine isn't quite like building microchips for your iPhone. Don't get me wrong, you don't want your iPhone exploding on you in any which way. But we're not machines.
Yeah.
We're not as much as we bring AI and the next generation of computer chips into everything. Every individual person is built a little bit different.
Yeah.
And mistakes happen. And I've made my fair share of them. And I know I live with them every single day. And those are the things that give it for medicine, probably in more than a lot of things, you'll always dwell on your mistakes longer than you will your successes. I can probably list more of the wrong things I've done than the successes. You shout out some of the accolades, but to me, it's just a small part of what we're trying to do. But the things that stick with me, that keep me up at night, that spur me to be a better person, a better surgeon, a better doctor, is just knowing that the mistakes that we've made in the past and trying not to remake them again in the future. I don't know. The such a fine line between what we do on an everyday, day-to-day basis that you don't want to be repeating those same mistakes over and over again. But at the end of the day, you do have to realize that it's part of the journey of where you are.
Like from mistakes,
You learn from them, and not to say that you move on. I don't think you ever truly move on, but we're really good about burying our feelings, and doing so for X amount of time though is a hindrance to your pathway to achieving any type of satisfaction.
Yeah.
Because I'm like from a culture where we just learn to push our feelings down to the side. And a lot of people are raised like that too, especially if you were raised in a medical community or medical family. And it's such an easy way to be able to live a life like that.
Yeah.
But at the end of the day, how are you going to be able to sleep? How are you going to wake up and go back and do the same thing over and over again? Well, burnout is a huge thing that we talked about in medicine, but across all career paths. It's not just medicine these days. And while there is something to be said about resilience, you mentioned earlier, that there are things that at the end of the day help all of us achieve what our goals are, what our dreams are.
Yeah. All right, let's move on to the next segment.
Right. I want to talk about your transition from academia to working in a clinic setting, private practice with a group of doctors. You spent years teaching the next generation of surgeons at Baylor College of Medicine and Texas Children's Hospital. What made you want to make that transition from that academia to working with the group of doctors at a private practice?
Transitioning from academic medicine to private practice was probably one of the hardest things that I had to do. I truly enjoyed teaching. I love taking care of the patients that I had. Sometimes it can be somewhat limited just because our group had quite a few people, and so there's an X factor of how many can you see, how many can you treat, and then I actually changed practices right before COVID hit. That was a huge monumental thing that occurred, across all fields, all walks of life. It affected medicine in particular quite hard. But I think just being able to mix in the variety, you mentioned, I trained general surgery, so I treat both adults as well as kids. And for me, being able to open up my practice to both the adults and children out there is what really spurred me to continue that kind of work outside of what the academic fields can do. I still have friends in the academic community, and sometimes I think, what if I stuck around and did that too? And it's things that I still consider, just because I enjoy speaking with, with the upcoming generation of people who want to go into medicine and are inspired by that too. And for me, it's a conflicting thing. On the one hand, you want to be able to have the freedom to kind of do some of the things that you wouldn't maybe otherwise be able to with some restrictive covenants, obviously, in place. But on the other hand, the camaraderie, with familial nature of being in an institution where we all kind of grow up. I spent 9 years in training, so I was familiar with how that world worked. And then moving out and trying to do things on your own is probably the scariest thing you can do. Because then it's the freedom, right? Like just like the minute when you finish school, what do you do next? And these are things that keep me up at night, and stress me out on a day-to-day basis. But I love what I do nowadays, and so my practice constitutes still quite a bit of reconstructive medicine, and then a little bit of aesthetic medicine as well. And I think that's a nice little mix between the two to keep my my skills sharp, be able to keep my my abilities and ability to help people from all walks of life kind of open.
Or was there any reason that almost kept you in the academia? Or
just comfort, just like anything else, like
the stable environment,
stability. The same reason why people like you spend a lot of years in school, because it's
there's a whole path made for you.
Yeah, so it's easier feeling. It's just kind of what you've done for 13, 14 years, 15 years, and it's tough to walk away and say, all right, now what? There's things are taken care of. You don't have to worry about like running your own office or staffing issues or things get done. Versus now kind of worry about all of that. And like I said, I've seen both walks of life, and I applaud everyone out there who's doing the good Lord's work with everything that they do, because it's tough, regardless of whether you're still in academic medicine or whether you're in private practice at all. People, there's just so many people, even in the Houston area, that need help. And I think Houston is such a unique place that we're able to take care of all these patients all at once.
Yeah. And now that you've seen both worlds, what's one thing that you miss from academia, and what's one thing that you valued the most in private practice?
One thing I miss most about academia
could be mentors, could be...
Yeah, I'd probably say the mentors. I don't go to as many meetings, which is kind of an annual thing, or to get to see colleagues from who I trained with, who I studied under. I don't go nearly as much as I used to, just because you're trying to have a steady practice and you're trying to take care of all these things all at once. So that's probably the biggest thing I miss, is that camaraderie. Anytime you're in trouble, you could just go down the hallway and ask someone who's been there and done that. And that's probably the biggest thing I miss. And then just, that's probably it. Is just not being able to see the people that I usually, hung out with all the time.
I love that.
But the people move on too, and their practices are different, and no guarantee that they're in the same place that they were either before. And so it's always neat to kind of catch up with people. There are always many reunions when you do that. One thing. So what was the second?
So one thing you appreciate the most at the private practice?
One thing I appreciate the most. I'd probably say the variety of things that I'm able to do now. There's a little bit more, patients who can be taken care of no matter their ability to get accepted, to be able to get the care that they need. A lot of things these days in medicine, unfortunately, are driven by status of your insurance. We have safety net hospitals out there, and that's what the academic medicine, unfortunately, is burdened with. But even amongst that, for patients who need that kind of help, who need that kind of care, then I'd be glad to say that hopefully I'm still able to deliver as much of that as possible in any which way that I can. It's a small contribution to the whole of society, but I do like having that freedom without someone kind of telling me, no, you can't do that. Or, well, we need you to be doing this instead. And that's definitely something that I've appreciated over the last, probably about 6 years or so.
Love that. Yeah, that's something I want to do too down the road. I mean, work with a big institution, of course, gain the experience that I need, make the good connections, and then move into like private practice. So that really motivated me. Thank you for that.
Yeah, no, that's definitely something that a lot of people do, or at least that they used to.
Yeah.
These days, it's a little bit it's a little bit tougher. You kind of have to make your decision a little bit sooner rather than later, unfortunately.
Yeah.
But that transition, that ability is still there. So which is it's a nice thing.
Yeah.
Let's
That-
move on.
I'm on next segment. So I came across around 17 publications that you've been on. And I want to kind of talk about which one do you think has made the most impact in your life and also your patients' lives?
Oh gosh,
It's a hard one.
Cool. See, most impact. I'll be honest, I don't know. I don't know, because they run from a wide range.
Yeah. No, this is a
different
very
things.
wide range of.
Yeah, it's a wide range of different things. A lot of those publications are done when I was in training, and a lot of it is when I just first got out. So it's a little bit like just throwing a bunch of stuff at the wall and seeing what sticks.
Mhm.
The one that probably I am most proud of is just helping with my co-editor at the time, just helping her arrange our one of our journals into looking at this maxillofacial trauma. That was something that I did quite a bit with. My internal surgery training was very heavily biased towards injuries in the traumatic patient, and then a lot of my training was also focused on that as well.
Mm.
So for me, I felt that at least for people to understand some of the concepts for how to evaluate and how to treat and how to take care of patients who are involved in traumas, I think that has been probably the more lasting legacy.
Yeah.
For me at least, or at least I've garnered the most satisfaction from. And everything else is just kind of this icing, and kind of, as you can see, they probably just dabbled in a whole lot of different things.
It's all those co-authorships, right?
You're right.
Yeah.
Exactly.
Okay, so I would kind of want to talk about plastic surgery in general. I feel like the stigma is that it's reserved for the wealthy or celebrities. And how do you kind of address that and kind of talk about how patients might feel that it's out of reach for them?
So plastic surgery as a whole has done, like you said, there's been a stigma about it. It's celebrities, wealthy people, or you see even shows like Botch.
Yeah.
Oh, well,
Yeah.
It's so far out of reach for the average person that you can't attain it. It's not achievable. But our society is or the Plastic Surgery Society rather, was actually founded on the principles of reconstruction as well. I know our big journal is called Plastic and Reconstructive Surgery for a particular reason, and it started out with treating injuries, whether from trauma or from congenital issues, and sort of branched out from there. And so for people who consider plastic surgery as just a cosmetic thing or something to look better, they forget that patients who are undergoing cancer get plastic surgery.
Yeah.
People who are involved in, like I mentioned before, car accidents or different types of injuries. For example, easy one, you fell on the floor at home just by accident, you got kicked in the face. You got a cut on your chin, for example.
Mm-hmm.
You're going to go to the hospital, you're going to the ER. And yes, ER physician can do a fantastic job, but if you are a child, I mean, chances are you're probably going to ask for a plastic surgeon to kind of help fix that. So that's part of it. And then for a lot of people too, with at least from reconstruction, they don't realize that plastic surgeon is very much involved with recreating something to make still more like. For the person considering cosmetic surgery, it has certainly become more affordable over the years, just because there is a full spate of surgeons out there. As our society has grown, as a plastic surgery society has grown, and people are seeing more and more of it out there, then that's definitely something that anyone can go out and look for. Now, some of the top names in the specialty in the field will continue to charge exorbitant sums.
Yeah.
That's where, just like anything else, I'm not going to be able to go out and get a Lambo tomorrow. So just like that, there's always going to be tiers for what one can get. But just like anything else, there are payment plans. There are little things that people do on a day-to-day basis that don't seem like it's plastic surgery these days, and it starts with something even very little as well. The rise in Botox or neuromodulators and fillers are things that people use to accentuate or improve certain things about themselves at, I don't want to say very little cost, but at fairly minimal cost. And then obviously as you move up the rung of what types of transformational change that you like to get, then that's where those added costs start coming in. But there's, again, and the fourth largest, maybe we're the third largest city or metropolitan in the country now. There's certainly no shortage of plastic surgeons out there, and the ability for patients to go out and see what's available and whether or not it is affordable for them.
Okay. And kind of talking about that, like plastic surgery is also viewed as construction or reconstruction, but mostly it's like the stigma of cosmetics, correct? But like, again, we see burn victims, go to plastic surgeons, like this is a whole reconstruction path as well. So I'm glad you brought that up as well, because I want to kind of break that stigma.
And I read somewhere that you also help patients with breast cancers and reconstructive work. So I love that. That must be a very rewarding experience for you.
It is actually. It's something that I take quite a bit of pride in. It's something that I started early in my training, and we all have personal stories for why we're still involved with it. And so it's still a very large part of my practice even today. And just so everyone out there is aware, October is Breast Cancer Awareness Month. For the ladies out there, moms, grandmas, aunts, sisters, doing self-exams is very important. And how we've been able to catch breast cancer so much more sooner thanks to screening programs, and we're able to stave off what used to be a very terminal diagnosis. Unfortunately, it's still very surgical in nature to remove it, but luckily with the advent and our own evolution and knowledge about the disease itself, a lot of patients are able to get back to normal lives without the stress of knowing that they're going to be deformed for the rest of their life. And so that, for me, is something that's very satisfying.
That's beautiful.
Very rewarding experience. More than the next segment.
All right. So I know you do both sides, the reconstructive work, as well as like the aesthetic surgery, cosmetic surgery at your practice. Why is it important to keep both sides of your practice alive?
Sure. That's a good one. So I continue to do both the reconstructive and aesthetic portions of my practice. I think that each one has its own set of skills, and they actually complement one another. Now, when I'm performing a reconstructive operation, I still think about the aesthetics of it and some of the techniques that I use there. I follow along with, or I use rather in my cosmetic patients as well. So it's just a reinforcement of the same concepts and ideas that you learn as a trainee, and what you'll find out too, and that's true of any physician talk to, is what we do today is definitely something that we didn't do back in training or back in school. Medicine continues to evolve, and as do techniques, and we're always trying to do better. And that's something that we're always striving to get to, just because expectations are higher these days. With all the knowledge that's out there, we feel that then why can't we do things better than they were before? Not to say that better is always good, but how can we improve upon our foundational knowledge, what we had in the past, and build upon that? And that old saying about standing on the shoulders of giants, right? So that's what we do every single day. And even 10 years from now, 20 years from now, what I do will probably be different than what I do today, maybe 5 years from now too, just because, not to say that we're experimenting on patients, but we get better. And just that repetition, you're seeing the same thing. And in fact, medicine is one of those types of fields where having that institutional and foundational knowledge for yourself actually allows you to go out there and build this database and a gestalt, whatever it is that you want to call it, so that when you can ID a patient and know, okay, how sick are they? What can I do to help improve this aspect of their lives? How quickly, how efficiently can I do it? Because that's also something that we're all looking for too. It just becomes dangerous if you're taking, 14 hours in the case of the patient under anesthesia. So you want to be able to develop the skills necessary for you to move fast when you can and then slow down when you have to.
I like that. And was there a patient or a case that changed the way you see your role, not just as a surgeon, but as a person?
No, I can't identify any one particular patient. I know that by the end of it, whether it's cosmetic, whether it's a reconstructed patient, I feel like my bedside manner has improved immensely in the 10 years or so that I've been in practice. And I'm able to carry on a regular conversation with people a lot easier. And so for me, being able to ask about some of their home life, their family life, their hobbies, those are things that probably help me out in the long run more than anything. And for them, I'm always looking for a shoulder just to talk to, right? Because everyone else talks to them about, this is what's going to happen. This is what you have to do. And just outside of the first initial couple of things in the post-surgical realm, once we get past that, there's no real restrictions that patients continue to have to do. There's some very slight monitoring that they may have to, but I'd rather hear about, their new grandchild that was just born 6 months ago, or, I've talked to patients about, I actually killed my grass during COVID because I didn't know any better. Patients told me, gave me advice on how to, improve it, how to make it better versus ripping it out. So home improvement projects, personality, these are all things that help me, at least in my practice, with carrying on conversations with patients. And I hope that's something that everyone else out there who is in medicine can hopefully also achieve. Now, again, there's a type for levity, and I'll be honest, my specialty allows that to happen a little bit more often, and I'm given that luxury a little bit more often than other specialties. So people who are seeing 50 patients a day, unfortunately, aren't going to be able to take that time to get to know you. And that's more a testament not on the physician, but just on the system itself. And that's where I think, hopefully, you guys and your generation of people can help make those changes, right? Because if we're going back with some old school techniques, it's spending that time with the patients, because everybody wants to be heard, right? Everybody wants to be listened to. Everybody wants themselves to be known that they're just not another number. They're just not another disease state for us to take care of. And so for that, I hope that people are able to get some of that information out. And maybe it's a little bit naive to think that we're able to do so, but that's at least my goal and the horizon for everyone out there as you continue your journey, as you advance up that medical ladder, not to lose that humanity, which is why people went into medicine in the first place. Because if you're looking to get super wealthy, I can tell you right now, this is not the way to do it anymore.
So many other ways to.
There's so many other ways to do it. If you want to be a social media influencer, you want to go to business, you want to play the stock markets, you can win the lottery. That was $1 billion a couple weeks ago. There are much easier ways than what it is.
And I feel like humanity aspect is I think one of the biggest parts of medicine that should be focused on more in like schools in general, is because if you're not a good human, you won't be a good doctor.
Exactly. Yeah. And you see that more even in, a lot of the focus in medical schools. And, my generation, people, other generations will deride a little bit of that. They're focusing less on the academics of it and the straight up knowledge. Knowledge these days is so much more accessible than it was. I was a medical student when the Palm Pilot was popular. When the Palm Trio was, we talk about the evolution of smartphones. So, the generation-esque of where I'm at, we both had books and papers that you had to go look up and having to go to the library. Well, you've got a library at your fingertips every single day, and that data continues to change and alter the way that you think and the way that you treat people. But having that foundation, that basis for for how to apply that knowledge, I think is very important. Because, when people say, well, they're just not as, they're just not smart, they're just not as knowledgeable about certain things. Oh, it's true to a certain extent. Part of it before is you had to memorize all these things because you couldn't just get up from a room, head to the library and look it up. You can look it up within a minute before you even walk into a patient's room to figure that out. And not to say that that's an easy or a lazy way out. I think embracing the future, embracing that technology is what needs to bring medicine into the forefront. We used to be at the cutting edge of everything, and now other technologies, other businesses have kind of taken forward with that. So medicine has always kind of lagged behind through to obstinate thinking, and I'm certainly in that way too, not being able to, so tight or closed-minded that you don't think about these things either. I certainly fall in that camp, certain things, and in other camps, I certainly see the benefits for what we do. Computers, unfortunately or fortunately, are here to stay. But when you talk to your patient, you don't have to have your laptop in front of you.
Yeah.
I mean, it's there, but they've got so many different things that can help you. At least take care of the paperwork aspect, that you can still look them in the eye and can say, hi. Or
the thing about AI is no emotion, right? That's one thing humans have is emotion. I think that's one of the greatest aspects of being a human.
Let's move on to the last segment.
Yeah. There's a couple quick questions we're going to ask is, you have to make a lot of decisions in your life. What's one of the smartest ones you made, and what's one you regret?
Smartest decision that I made? Probably two, I guess. Probably going to medicine and being able to do what I do. Again, part of it was luck, some of it was opportunities, and a lot of it was hard work. So it's a combination of all three with where you are in life. So I think, I'll get asked frequently, can I think of myself doing anything else? And unfortunately, I love what I do. It's something that helps me sleep well at night, helps me wake up every day looking forward to doing the things that I like to do, what I love doing. Number two is probably, I'd probably have to attribute that to my family. Both my parents, and they're both hardworking individuals, and so I take inspiration from them. And then lastly, I guess if it's 2.5, 3, my wife. She's a bedrock, right? She's been there pretty much from the beginning. She's seen the highs, she's seen the lows, and that's what I talked about earlier about the support system that you need. So whether it's family, whether it's friends, the people you meet along the way that you can call them up, text them, whatever mode of communication that you want, be able to, if you're at the lowest of your low, that you can just pick up the phone and just chat for a few minutes to work yourself through and say, all right, maybe it wasn't that bad, or they'll tell you, yeah, it really was that bad. But at least they will have been in a similar situation too. And so with those three things, those are probably one of the better decisions that I've made in my lifetime. They'll be different for each and every one of you guys.
Yeah. Great answer.
And burnout is something every doctor faces at one point of their life. How were you able to manage that? I know you talked about your family and having the friends. Was there any other aspect to it?
No, I can't think of anything else. It depends on, again, what your priorities are. I enjoy watching golf as I don't just play very much, but the number one golfer in the world is a guy named Scotty Scheffler, and he has been able to separate his golfing life from his family life. For him,
so that's an inspiration for you.
A little bit, and it's a complex answer to a simple question. What inspires you every day? Why do you do what you do? We all get satisfaction in our professional lives, but at the end of the day, in the overall scheme of things, what does it mean? If you can't, if you can't go home and preserve the sanctity of the relationships that you already have with your kids, with your parents, with your family, your spouse. Because any of the accolades you have, the people who can balance those two are people that I certainly look up to, because it's such a challenging thing. Medicine is tough enough as it is, that to be able to balance those two is something that I think a lot of us aspire to. Not to say that that's good or bad, and I'm not one to judge. So I know who or what you should prioritize. And of course, taking care of the patients is always a priority for all of us. But I find that message hits home just a little bit too, just because what we do in medicine is a little bit unique. I don't know, I said microchips or cars, and not say that there's nothing wrong with that. I'm not out there outside doing hard work either. But I think there's a real lesson to be learned about the type of effort that you put forward every single day.
Well, Dr. Truong, this has been amazing. Thank you so much for being here today with us. I certainly can resonate with you a lot, and I'm pretty sure there will be a lot more students out there that can relate to some of the stuff you said. So thank you for inspiring all the students.
Well, thank you guys again. It's always a pleasure chatting with I guess young people. I'm not that young anymore.
You look young,
especially those who are trying to achieve what their dreams are. And I think having podcasts and naming it the Dreamers too is something that I look forward to seeing you guys out there.
Thank you so much.
Thanks for the future.
And again, for our Dreamers audience, like, subscribe, share. We're going to keep bringing individuals who have amazing stories to tell and keep providing content for you guys.
See you next time.